to the Everyday Therapist. I'm your host, Dr. Deb, and this is a place where we talk about clinical issues and research in psychology. Now, I know it's been a bit of a while since my last episode, and the reason for that is I have been busy taking all of my episodes and basically making them into podcasts and disseminating them to the podcast place of your choice. So, Spotify, Apple Tunes, those are the main places that I've sent them. Also, I have started a Substack where I'm writing up various articles of interest, well, things that are interesting to me, and you might find them to be interesting as well. Also, I can put my video podcasts there as well. So that could be a one stop place for you in order to see my content. And that's what I've been doing for the last couple of weeks because it takes time to move things from one place to another uh, and making sure everything gets where it needs to be. So today's going to just be a very short discussion about another personality disorder in the cluster B set, and it is histrionic personality disorder. Now, this is one that isn't very prevalent. In fact, the estimate of prevalence is somewhere between like 0.5 to 2%, depending on which subgroup one is looking at. And to diagnose somebody as having this type of personality disorder, there are several criteria, and only 5 need to be counted in order to make the diagnosis. Now, you can almost imagine that word histrionic. It comes from the same root as hysteria, which means just sort of being over the top and overly emotional. Um, and in the past, women have been accused of being hysterical more so than men. But as I said, in terms of this personality disorder, it's pretty much equal. So let me go through the criteria, and you may think, do I know anybody who fits that? But I should point out that these criteria overlap a bit with some of the other personality disorders. And one can actually be diagnosed, say, with borderline personality disorder plus histrionic. So let's go through these items one by one. And I have my little cheat sheet because I forget sometimes. Okay, number one, needs to be the center of attention. This would be, say, somebody who makes a grand entrance into a party and expects everyone to flock around him or her, sort of paying tribute to the person, because that's what the person expects that he or she needs to have people do. Number two, often will be inappropriately sexually seductive or provocative in order to, again, pull in people and get the attention that somebody with this disorder really craves. Number three, this type of person will have rapidly shifting emotions, will be very happy and outgoing, and then all of a sudden very depressed and sad. And the thing is, these emotions tend to be rather shallow. They're not tied to really important events or things that most people would not see as important. For example, say someone with this personality disorder, say a woman who is wearing a pair of nylons, if she ends up with a run in her nylons, that will be the worst thing ever that's ever happened to her. Until somebody says, "Oh, that's a very pretty necklace you have." And then the person will say, "Oh, thank you. That's my most beautiful, treasured possession." So you see, going back and forth, and they're not very important events in most people's lives to cause that level of emotion. Okay, the next one, again, sort of going with my example I just gave, consistently using physical appearance to draw attention. So the fanciest clothes, you know, fanciest jewelry, things that people will respond to and comment about, because that's what somebody with the histrionic personality disorder wants. They want people to comment, pay attention to them. Next, People with this type of personality disorder tend to speak sort of in generalities. They may use kind of flowery language, impressionistic language, but if you pare down all the words, trying to get to the kernel of what the person is saying, there really isn't much substance there. The person is not going to be someone who gives you facts and details uh, about various situations in life. For one thing, they are not interested in those sorts of things. Again, they want to impress people, have people fawn over them, make a lot of, uh, give them a lot of attention, and so again, they may be very verbally facile, but they're not really saying anything. Okay, next. This one pretty much I've already talked about, but these types of people tend to be very dramatic and exaggerated. Uh, Again, with my example of the person getting a run in her stockings, that she might present as, this is the worst thing in life that I've gotten a run, and oh no, I'm going to die because of the run in my stocking. So again, being just very dramatic and exaggerating the emotions and things like that. But this unfortunately can lead to something that can be very unsettling to others around. Often, someone who has this kind of diagnosis will, during, say, a very exaggerated time of depression, say, I am so sad that my dog took a walk without me, or something. That At that level of verbalizing sadness, often these people will verbalize suicidal intention. Not that they're really going to, but they may use those kinds of words, again, to get the attention, get everything focused back on them. Also, um, people with this kind of problem tend to be very suggestible because they're trying to figure out what is going to elicit the most response to them from others, positive response, not negative. So if somebody says, oh, let's go eat Chinese food, uh, somebody with the histrionic personality disorder is very likely, even though he or she may dislike Chinese food, will go along with it because it's being suggested. And so, in order to have somebody else say, oh, yeah, you really like this, don't you? Then the person would just go along with it. Now, the last one of these various criteria can be very serious in terms of how a person with this kind of personality can get along in the world. And what this is problem is that people with histrionic personality disorder tend to think relationships are deeper or more intimate than they really are. This is the sort of situation, say, um, a person, say a young woman goes into a restaurant, say McDonald's, and there's a cute guy waiting on her, and he says, here you go, have a nice day. Somebody, the young woman, if she has histrionic personality disorder, might say to herself, oh, he likes me. He's going to be my husband. Or you can reverse it and have a young man going through the exact same thing, thinking, oh, she is going to be my girlfriend. We will get married. So it's, just a casual meeting in this person's mind can mean something much greater than what it really is. So those are the criteria for identifying histrionic personality disorder. And there is a certain, as I said, a certain overlap of these criteria with those uh, associated, say, with borderline personality disorder. In borderline personality disorder, there frequently is, the person will have a need to have positive attention from other people. And there might be a certain instability with relationships. And somebody who's borderline, in order to pull in somebody to give, to try to get that person to love them, will use certain things such as being seductive, in order to, again, get the positive affirmation that somebody with borderline would want. the difference is that somebody with borderline will be looking at uh, those people around him or her in positive light for a while, and then will devalue them into negative, uh, because somebody with borderline has more of a black versus white kind of view of people, and people can switch back and forth in that borderline personality disorder person's mind. Histrionic personality disorder does not have that kind of black and white thinking, because the focus is really just on pulling people in to give him or her the attention. So it's very much an attention seeking type of behavior. So that's all I'm going to talk about in terms of histrionic personality disorder. As I pointed out, it's not very prevalent, and it's neither men or women show more or less of it. So again, it's one of the rarer ones. Next time, I will be talking about narcissistic personality disorder, and that's one that a lot of people tend to focus on. And unfortunately, it's one that therapists tend not to see much in a clinical setting, because somebody who has narcissistic personality disorder doesn't think he or she has a problem. It's everybody else. So that's all for today. If this has been a useful video for you, give it a thumbs up, subscribe, ring the notification bell, do all those things. Follow me on Spotify or Apple Tunes or Substack, wherever you want to find more content, especially with the Substack, since I'm doing writing there as well. There's a whole lot more. So take care, and I will see you next time on The Everyday Therapist.